again, you don't have to agree with everything he says. You don't have to agree with everything I say, but hopefully together we can learn something. It'll also hopefully be an advantage over last time where the sound didn't work.
Live event is currently in music
there's that.
And will start momentarily.
But hopefully this time, think we got the sound problem solved.
Press *3 on your telephone keypad.
I'm honestly not really even sure what they're going to talk about tonight, because it doesn't seem like they have a real clear idea of what this next round of stimulus is. Whether that's going to be some type of, additional grant, or they're just going to find a way to give more people money. We'll see. Welcome to the stream.
The Access Live.
But I always do find it interesting that they say they're going to start here at 6:30.
If you would like to ask a question during the event, press *3
it's always
on
about
your telephone
5 to 10
keypad
minutes
at any
late,
time.
But when it's time to leave, man, they end on the dot. They are not talking to you for more than an hour. They don't care, no ifs, ands, or buts about it.
Access Live event is currently in music hold and will start momentarily. If you would like to ask a question during the event, press *3 on your telephone keypad at any time.
Welcome. Feel free to, as we are waiting for the real town hall to start, to ask me any questions. Can't guarantee I have the answers, but I'm certainly happy to talk through them. Always trying to learn more things. Something that you're reading that you like, great. Something that you read this week that you didn't, also let me know. Again, we're only going to get this together. This campaign, this kind of movement only really works if together we're making this work. Oh, maybe start?
Hello.
Oh, we are starting.
Congressman Colin Allred's telephone town hall and briefing on the response to the coronavirus. My name is Josh Stewart. I'm a North Texan, and I am Congressman Allred's Senior Advisor and Communications Director. Tonight we'll be discussing a lot of resources available to you. And to start, if you're all at home in front of a computer, you can visit allred.house.gov/coronavirus. There you can find all kinds of resources that we'll be going over today, and hopefully answer any questions you may have. We'll be hearing from Congressman Allred as well as local leaders and experts shortly.
See what they got.
But first I wanted to make a few announcements. It's Congressman Allred's top priority to hear from you and to stay in touch with folks in North Texas. If you'd like to stay up to date on his work, you can press *6 and we'll add you to his newsletter. Next, if you'd like to ask a question, you can put yourself in line to ask a question by pressing *3.
I'm also
we will
still
have
very
a lot
confused.
of questions,
They add,
and if we don't get to your question,
so they've done this very weird thing where they have you can ask your question online, but they never seem to take any of these questions. So
at the end of the call, you'll
strange.
be able to leave a voicemail and ask your question that way.
Okay,
We're going to be going over these rules a few different times during the call, so if you missed it, that's okay. Just know you can press *6 to subscribe to the newsletter and *3 to ask a question. Now, I'm going to hand it over to Congressman Allred.
Well, thank you, and thank you all for joining me. This is Congressman Colin Allred. Tonight we will be joined by Dallas County Judge Clay Jenkins for as long as he is available, and Dr. Julie Trivedi of UT Southwestern. And I want to thank our local leaders for their leadership in this time of crisis and encourage everyone to continue to follow the stay-home, stay-safe measures that are in place in Dallas and Collin County and across the state. I want to start with some good news for our region. After a month of negotiations, we secured a new VA hospital in Garland. It started serving veterans with COVID-19 today. This facility will create thousands of jobs, serve 184,000 veterans, and save us $1 billion in creating a similar facility. Now, this is a serious time for our nation, and I know many of you are worried.
Any good news this
on
point.
doing everything we can to defeat this virus. Dallas County announced 104 new coronavirus cases on Sunday, for bringing us to a total of 2,428 COVID-19 cases in Dallas County. We also had 124 reported on Friday, 134 on Saturday, 104 on Sunday, and the county's coronavirus fatalities now total 60. In Collin County, officials have reported 5 new COVID-19 cases on Sunday, bringing their total to 527. There are 190 coronavirus cases in the county, with 16 people being hospitalized and 174 people are in home isolation. The county has reported that 324 residents have recovered from COVID-19 and 13 have died. Nationally, we now have over 40,000 deaths and more than 800,000
I still just wish that this felt more of, an at-home thing.
There's
This
been
just
some
feels like
progress
someone
in
just
the
reading
curve in
off a
North
piece
Texas,
of paper.
and I want to thank
again, that's
so
what the
many of
internet is
you
for. If you want to just
all
look up
that you are
facts and
doing,
figures.
in your personal lives to help us flatten the curve and to prevent the spread of this virus. But what we need now is a plan and not a date. In order to reopen the economy, we have to listen to the experts. Social distancing alone is not enough. We've seen this in countries across the world. We must continue to follow the social distancing guidelines, but we also have to dramatically ramp up our testing capacity, implement a robust contact tracing program, safely quarantine those who have been infected and exposed, and improve treatments so we can save lives. This plan will require a national mobilization across our communities with all levels of government working together. The governor of Texas has made an initial order to cancel school for the rest of the year and to begin to reopen some businesses on a limited basis. I do have some concerns about reopening all of our businesses without specific benchmarks and a plan to lead us through this. While we are dealing with
I agree. I don't get what this
we
is.
put in place to help our Texas families. I know many of you have heard about some of the work that we're doing in Congress to try
Tell me I can go talk to someone and then I'll wait for them to make a
I want to
decision.
explain
Doesn't really seem
how
to
that
be
is
worth,
working and how it will
$160,000,
We
whatever
recently
many
passed a
members
bill
of
that
Congress
will
get
provide payments
paid.
of up to $1,200 for each individual, $2,400 for joint filers, as well as an additional $500 for each child in that household. These direct payments phase out for incomes above $75,000 per individual and $150,000 per household. For Social Security recipients, your Social Security income will count towards the $75,000 income threshold, but you are eligible to receive these direct payments.
Well, I guess it doesn't
Some of
want
you
me
may have
to
already received
comment
direct
from
deposit
Restream.
payments
No.
as they started going out on
RIP.
April 13th. In order to receive a check, you have to have a Social Security number, and you can check the status of your payment online on the IRS website at www.irs.gov.
But does the IRS website work? That's the real million-dollar question.
/get-my-payment. The goal here is to leave no one behind, but I realize that inadvertently some loopholes have entered the bill that have left some folks not receiving payments, particularly those who have adults with disabilities that they are caring for, and we are working to close some of these loopholes. For those of you who have lost your job through no fault of your own during this crisis, we've also dramatically expanded unemployment insurance with a $600
Again,
increase.
if you can get the unemployment insurance.
The goal here is to replace lost wages for up to 4 months. If you are a gig economy worker or self-employed, we've also expanded the criteria for benefits, and you will likely qualify as well. So if you are working or have lost your job or have lost the work that you
Yeah,
did,
he really does need some original material. I just, after a certain point, I think this is the third or fourth of these that he's
If you have any
done.
questions,
It's
about
like,
unemployment
you're
insurance,
not the news.
contact my office.
Sure,
or
to some
the
extent
Texas
does
Workforce
Congress make the
Commission.
news, but you need to have
This
something that's
information is
relatable.
all
Like,
on my
understand
website.
the fact people are frustrated.
Okay,
Don't just pretend like, oh, well, here's what's said, so good luck,
allred.gov
figure it out.
/coronavirus. For small businesses, we have made rent, mortgage, and utility costs eligible for small business loan forgiveness. We have issued emergency grants of up to $10,000 to provide immediate relief for small
Which
business
I'm pretty sure a lot of these programs have run out
and
now,
SBA
so
will
good luck
cover
getting that money.
6 months of payments for small businesses with existing SBA loans. There are several types of loans and assistance, including the Economic Injury Disaster Grants and Loans, a Paycheck Protection Program, and Small Business Debt Relief Program. If any of you on this call have applied for these programs and you're having any issues, please reach out to my office and we will make sure that we help you navigate these programs and get answers or get access to the funding that
So I think that really what they should
Volume
have
of
is they should have the
applications
opposite.
that
They
is
should have, if you've been
exceed
able
our
to
small
benefit
businesses
from
and
these
the
programs,
these
could you
programs
please notify so then they can prove
incredibly
these
clear.
programs work?
My team
Because
and I
so
have heard
far all I'm finding
too
is
many
most people are saying
have
this
been
program has not
frustrated
helped
with
me.
their bank
Or you have
and
Ruth
programs.
Chris or Shake Shacks, they get their money,
Programs are a
but
lifeline.
not everyone
It's
else.
important to get caught up in red tape. And every day matters. and we have no time to waste. That's why I led a bipartisan group of my colleagues in requesting answers and information from the Small Business Administration on how to fix
Again, not an answer.
Additionally, this week Congress will pass supplemental SBA funds to shore up these programs as soon as possible and to ensure that our small businesses get the help that they need. We have created a guide for small businesses on our website. You can access that document by going to allred.house.gov.
I really just decided at this point that the SBA is really not the Small Business Administration, it's really the Screw Business Administration, because it doesn't seem effective at doing anything. It has all these blockers, all these little hoops and hurdles, and it makes people feel good about themselves that they're helping small business as they go out of business. But sure, let's ask them questions.
And waiving interest and penalties on federal student loans. And the tax deadline, as you probably have seen, has been pushed back to July 15th to help taxpayers. As I mentioned, this week we will pass another bill that will provide over $300 billion for small businesses, $75 billion for hospitals, and $25 billion for additional testing. Our healthcare workers are still lacking the equipment that they need, and we are still behind on our testing. That's why I've urged President Trump to fully utilize the Defense Production Act to help mitigate any supply shortages by directing the domestic production of equipment that's in short supply. But you can help by donating or selling equipment to Dallas County by visiting dallascountycovid.org.
I'm also not sure these people at this point, we're a month in, are really holding out on this material they're going to donate. I feel like if you're going to have donated, you probably have donated or sell whatever that's supposed to be.
The administration has not done more to get us to where we need to be. Eddie Bernice Johnson and I have written a letter to the administration urging to get more resources to our local leaders. We hope that will be coming soon. Again, for those of you who are just joining, this is Congressman Colin Allred. Thank you for joining us on this telephone town hall. If you have any questions,
while he's talking, I'm pretty sure this is the best. Let's see if I can find
take your question. And even if we don't get to you, we'll make sure we get back to you in writing after this call is over.
So
now,
this program here that's called the Emergency Money for People's Act. This is the best thing that I've seen that's come out of really anyone. But
thank you, Congressman.
I don't know if that's they're planning on passing or if they're planning on passing something else.
To get us more testing and more resources, which we desperately need here. Later tonight, I'll ink a deal with HHS for some more mobile testing, for some flexibility in mobile testing, which we'll use to go out and do more robust testing in nursing homes. Where we are right now is we have the capability to do about 27 tests per 100,000 people. I think that's the daily number, and our doctors tell us that needs to be 136. We can achieve that, folks, if we can get reagents and kits to the super lab that we built at UT Southwestern in Parkland. We can do for Dallas County and for North Texas what the University of Washington did for the Seattle area, but only if we can get the reagents and the kits that we need to go with the expensive machines and the people that we've already purchased. Unfortunately, if it were a matter of just spending money, UT Southwestern and Parkland would already have it, but there's a shortage of supplies, and we need our federal partners' help and our state partners' help in getting those needed supplies. That's important for two big reasons. The first is, if we don't have adequate testing, we cannot determine what is actually happening out there. We're doomed to have to guess what's happening based on 5 or 6 day old information.
I know many of us hate using PowerPoint, but I think at this town hall, I think that's one thing that works for Governor Cuomo, is having something to look at. Just staring at this or having people, call in. It's missing some sort of visual aid to say, okay, here's our goal, here's where things tracking, here's what's working, here's what's not. I just think that there's such a disconnect here.
That's the only way you can determine whether the section that you're opening is working or if it's leading to a second COVID wave that will drive us all back into our homes. But if you don't have the testing, you don't find out what's not working until it's too late to modulate it and scale it back without having to drive us all back into our homes. So it's very, very important that we have that testing. Let me talk to you real fast about what it means and what it doesn't mean to loosen some of the restrictions to open the economy. So you've heard about retail to go. retail to go being the concept that you can order things online or call and pick them up, and you go to the store and they put it in your trunk. This does not mean that when that starts, we all can forget about our safer at home rules. We all can, go do all the things that we've been doing before this began, have large meetings and, have a party in our backyard. If we do that, then we'll never get to that second section of businesses. Unfortunately, we're stuck in this place of having to make those good personal responsibility decisions to stay 6 feet apart, to cover our face with a cloth covering when we go into these essential businesses like grocery stores where we'll see a lot of people.
So no one has a plan here.
Because if you rush it, you ruin it, right? It's if we think about baking, or if we think about golf, I'm not a golfer, but I understand if you rush your shot, you ruin it. And so you've sacrificed greatly. We don't want to rush and disregard orders right now. We want to let these loosenings work and only do those when we have adequate testing and they're approved by our health professionals as well as our business leaders. We can't let, as much as I respect business leaders, health professionals are playing a very important role for us here in Dallas County and throughout the state.
Which is totally fine. If you're going to tell people that it is dangerous to go outside or they can't work, then the flip side is you're going to have to support them. If you're going to tell people that, you need to stay inside or, it's dangerous, well then, people are going to get really frustrated when they say, I don't have money for food, I don't have money for rent, no one's helping me. So people get desperate. And this is something that I've been kind of reading in kind of, different spheres is like there's this, two different kind of schools of thought. If you can work from home and you can, get by, then great, you're fine. But if your job is not something you can do online and you're saying, how am I going to make my basic needs? And you're saying, when can I go outside? And just saying, well, we don't know at this point. That's not good enough. Again, we live in 2020. Have a few different models. Have a few different simulations of this is what we think. These are some of the predicted data. So at least we can start moving there and not just having this, I don't know.
The testing, thanks to the work of many people, including Congressman Allred, who's really... he and Congressman Johnson and Congressman Vesey have really gone to bat for us to get these testing increases. We now do 500 tests a day at the AAC and at the Ellis Davis Fieldhouse. We've loosened the restrictions on who can get a test. So from the beginning, if you were a police officer or a healthcare worker, you could get a test even without the symptom, even without the fever or the cough. That was later loosened to anyone over 65 or with an underlying condition need not have a fever or a cough. Today we've loosened that to being retail workers. So the grocery store clerks,
so there's this, while they're talking about this, I think there's also
without
South Korea
as well. And we'll meet again probably later tonight in the morning about other loosenings that may happen there.
So what I'm trying to find is there was something that I read yesterday that talked about how there was a dad and his daughter, I believe, one's a healthcare professional, one's not, who basically went around their life like normal after this reopened, and then now they're reinfected. And I'm not quite sure how this is going to help solve that problem.
Where there's high uninsurance,
I don't see,
and in nursing homes. We went ahead and took 80 of our tests, that were our Parkland tests, and we went to a nursing home in Duncanville, Texas, on Saturday that only had 2 COVID positives that were known of. All right, we tested the other 80 patients there, and now there are 20 COVID positives that are known at that nursing home. And that's important because obviously, if 18 people are carriers that you didn't know about.
Not seeing it, but it was very, very strange.
You're treating those 18 differently.
And I just don't know how they're planning to handle people that don't know they're sick.
It's important that that's one of the illustrations of testing. So what we're going to be trying to do in our next ideation of testing is we're going to be pushing out mobile units, vans from Parkland with test kits that will take these tests that we're doing at AAC, same type of test that we're doing at AAC and Ellis Davis, take it to that place like a nursing home or somewhere where people don't have the ability to drive in to get their own test. Get that, carefully, deal with that and the medical waste from that, and get that back into our batch. Our batch will be a little higher than 500. Get that back into our batch to go into the lab. One other piece of good news on testing, and this is true whether you go to one of our labs or whether you go to, the hospital near you or your doctor's office. Most testing goes to either LabCorp or Quest. These are two gigantic labs that do a lot of testing. Now remember earlier we talked about UT Southwestern and Parkland creating their own lab super site. But most tests, you go to the Baylor Hospital near you, it'll go to QuestCare or LabCorp. 2 weeks ago, you were seeing sometimes a 7 to 10 day wait time to get your test back. Those wait times are now down to two, sometimes less than 2.
That also has something to do with the fact that
3
those
days.
companies don't have
So we're
any
seeing
other
those
business
numbers
now.
go way down. So, and that's
Which
true whether
is
you
good.
go
I mean,
drive-through like
great that it's
AAC,
faster, but I don't really know how that's going to work when
with those,
life goes back to normal.
Test, you're seeing a 2 to 3 day wait, not a 7 to 10 day wait. So that's a plus as well. Our local doctors have looked at Governor Abbott's proposed orders, and since he came up with his proposed orders on elective surgery, the American, I forget what they're called, American Association of Surgeons, the industry groups have laid out their policies for elective surgeries. Our hospitals would like to follow those, and we're communicating back and forth about that. And in fairness to the governor, of course, those didn't exist when he came up with his order. So now that they do, we'd like for looking at those. And similarly, each area of Texas is different, right? So things that might work in Lampasas or Lockhart might not work, in Lancaster. And so what we're seeing is still, we haven't picked, when you look at the 4 counties together, they're not much bigger than Harris County, but they're a lot sicker than anywhere else in the country. And so, or not the country, but the state rather. So our doctors, our public health group, which makes up infectious disease directors and epidemiologists from the major system hospitals, are sharing with the state and the governor's office some of our thoughts on those things, and we're trying to work through those things before the final orders come out on them. And that's, I guess, Congressman, that's pretty much the update for tonight.
Thank you so much, Judge Jenkins, for that update, and thank you for all the work that you're doing. And please tell Dr. Wong, thank you from all of us for the work that he and his team are doing. It's saving a lot of lives. So for those of you who are just joining, this is Congressman Colin Allred. Thank you for joining our telephone town hall. If you have a question, you can press *3 to get in line to ask a question. I will now hand it over to Dr. Julie Trivedi from UT Southwestern. She works in the infectious diseases and geographic medicine part of UT Southwestern. And thank you so much for joining us tonight, Dr. Trivedi.
You're welcome. Thank you, Representative Allred, and thank you, Judge Jenkins, for providing these updates that you have so far. We too at UT Southwestern are very grateful for the support of the county, as well as having a close collaboration with many other hospital systems in the city of Dallas and in the surrounding areas here. So my name is Julie Trivedi. I'm an infectious disease specialist at UT Southwestern in the Division of Infectious Diseases. I am also the medical director of infection prevention for the UT Southwestern Health System. And as such, when COVID began to make its way around the world, A lot of our preparatory work at UT Southwestern was regarding being able to identify individuals and more recently being able to take care of them in the hospital, as well as testing and developing other treatment protocols. So I just wanted to provide a little bit of background information again as far as numbers are concerned. So the state of Texas is reporting over 17,000 cases. There has been 190,000 tests that have been performed in the state of Texas, which with approximately 10% of tests returning positive. The DFW region, which accounts for about 7 to 8 counties, is reporting over 5,000 cases with 133 deaths. And as
so almost halfway into this, and I still feel like all they're doing is talking about the virus as if it's an academic exercise. So you have this, which is like very academic in nature, and then you have these questions that maybe they'll start in 10 to 15 minutes that are all going to be about how can I get help. And
what we have been seeing in the hospitals thus far, as far as cases are concerned, is that the past week or so had shown a decline in the number of patients requiring hospitalization. However, as we have seen in record numbers as far as new cases being reported over the weekend, this may begin to change as far as the number of patients requiring hospitalization and care in our medical facilities. So this is related to identifying additional cases in these vulnerable patient populations. And given the difficulties with being able to self-isolate or self-quarantine in such close proximity with each other, there is definitely the potential for transmission of disease from one individual to another. There was a model looking at the state of Texas showing that about 1 month ago, looking at this number, what we call the R0, which is essentially the number of people an infected person can potentially expose and infect. And about a month ago, this R0 for the state of Texas was reported to be about 3, indicating that one infected person could be infecting up to 3 additional individuals. Last week, we were able to see that that number came down below 1 and has begun to climb up a little bit and is currently 1.2. For an epidemic to end, that number should be below 1. And however, as we see warmer weather and more individuals moving about the community, it is possible that this R0 may increase, especially if appropriate precautions are not maintained. At UT Southwestern and Parkland, we have the same infectious disease faculty that do work at both institutions, and many of our other faculty work as far as our intensivists and the hospitalists do work at both institutions. We have worked together towards developing several clinical trials available at UT Southwestern and Parkland, as well as several other healthcare systems in the area have also developed their own clinical trials. These include the drugs of remdesivir, sirolimus, and more recently, and hopefully with increasing promise, the convalescent plasma protocols. To touch upon antibody testing, the task before us right now is to be able to validate the assays to help define some baseline information, such as antibody levels in those who have had confirmed infection, and as well as trying to understand what.
I guess we're going to continue this academic exercises. I mean, I'm about to zone out for this. I mean, this is just not.
There are a lot of unanswered questions.
Not helping the people who need help. Again, I'll be honest, I don't really care about the 60 different trials you have. Yes. Is it important? Sure. I don't need that update now. I need to know how people are getting help. My friends are getting help, my neighbors are getting help, how hopefully many of you are getting help. This does not.
What we are doing
I just don't
here
care.
at UT Southwestern.
Yes, like it is important to solve this virus. It is important to get testing. But if people are going to take time out of their evening, most of the people again tuning in are like, how do I get help? They're not concerned about the different protocols or R0 values.
Let's say those individuals who had surgeries canceled for the past 2 months, and maybe other individuals with necessary care. We are concerned that the numbers of people coming to the hospital with strokes, heart attacks, and other types of acute illnesses has declined significantly, and we know certainly that that does not mean that these illnesses are not happening. And so we are wanting to reassure the general public that it is still safe for people to come to the hospital if they are experiencing illness that does require hospital-level care, even if it is not related to COVID. Our facility, along with many others in the
Well, they're probably more concerned about how they're going to pay for it now that many of them have lost their job.
To identify individuals, test them appropriately, being able to isolate them if they do have COVID, and to treat them appropriately, along the same time as providing care for individuals who are not in the hospital for COVID-related reasons. And so we are in the process of putting together additional protocols for evaluating patients who might need to have a surgery done that had been canceled in the past 2 months, and what we can do to help protect healthcare workers who would be caring for these patients, as well as being able to better identify in the community, how frequently we're seeing COVID infection as well. So I would agree completely with Representative Allred and Judge Jenkins as far as the need to expand testing in the community, as well as with our patient populations. I know we here at UT Southwestern are standing by to be able to assist in whichever way possible that's there. What people can do to stay safe.
Speaking of the having the PowerPoint, again, I think that would be nice here is some visualization that's like, here's the parts of DFW that are hotspots, here's where we're concerned, here's where, you should be careful around. But, again, we're gonna test them. Who knows what that means? We're just gonna do more testing.
Provide them with a mask while trying to maintain and preserve our own stocks and supply of personal protective equipment. What we also recommend is, ongoing hand hygiene using alcohol-based hand sanitizer. It is important to be able to get exercise and be able to spend some time outdoors while still remembering to maintain adequate physical distancing spaces from other individuals who are not part of your family and household unit. And this is also an important time to be able to check in on friends and family members who may be isolated, either and to check in on them from a mental health purpose as well as for their own physical well-being. So that's essentially what I have so far as the infectious disease and hospital epi update. And again, I'm more than happy to be able to take any additional questions, should there be any. Thank you.
Thank you so much, Dr. Trivedi. To those of you who may just be joining or joined since I last spoke, thank you so much for joining our telephone town hall. This is Congressman Colin Allred. You can ask a question by pressing *3, and I think now we will take our first question.
Yep, we've had a lot of folks ask questions regarding flattening of the curve, regarding testing, and what testing looks like. So I wanted to start with a question on testing. We have Mr. Francis Gabriel Stelly from Dallas. Francis, you should be live now to ask the Congressman your question.
Great, thanks for taking my call. First, a comment. I'm worried that if we see the curve flattening, it might be an artificial problem where our testing is flattening, and we shouldn't fool ourselves by that. So my questions are, why is Texas so far behind all other states in our testing per day? And then finally, what is the goal to get to in terms of the percentage of the population that we need to test to know that we're getting a good sampling? What fraction of the percentage or percent of the population per day should we be testing?
Well, thank you so much, Francis. I will first say that unfortunately you're right that we are behind on testing. We are, I think, second to last in the country in terms of testing per capita in Texas. I will say for Dallas County that we were the first county in Texas to be able to test for coronavirus, and we do have excellent folks at Dallas Health and Human Services, as well as UT Southwestern and Parkland that are doing a good job. We have the capacity to do many more tests than we are doing, but we do not have, as Judge Jenkins said, the reagents, which is the chemicals used in the testing, or in some cases the PPE, to conduct the testing on the scale that we need to. And Congresswoman Eddie Bernice Johnson and I have been on several calls with FEMA and with the Department of Health and Human Services to try and increase our testing capacity, and we have sent several letters, including one today.
Oh, they sent a letter, so everything's going to be great. No.
Provide us with the materials that we need so that Dallas County can conduct its tests, because the county does have the capacity to do many more tests than we are doing right now if we can get the federal support. And so that's been my focus, to try and make sure that we support Judge Jenkins and his team in their efforts. And if Judge Jenkins is still on, I'll let him add anything he wants to, and Dr. Trivedi as well.
Yeah, I'll add this from a report on situational awareness today from the health team that's led by epidemiologists and infectious disease doctors at the biggest hospitals. So in pertinent part, it says, unlike other communities in Texas, Dallas and the surrounding counties continue to see increasing COVID-19 cases despite the preparations. In particular, cases in Dallas County and Tarrant County continue to increase, although hospitalizations are stable. Testing capacity in Texas is currently 27 tests per 100,000 persons, and we need to have a capacity of 152 tests per 100,000 to safely loosen non-pharmacologic interventions. So that's from, and then one other thing they say is Dallas and Dallas County have not yet met well, you might not know what that is, the trigger to move to phase 2 per the American Enterprise Institute framework. So that is, if you remember, President Trump said, whatever day it was, Friday, I think, or whenever he did his press conference, that he wanted to see this leveling off and actually this lowering of cases for 2 weeks before we opened up things, and we're not there yet. So the testing number, according to our doctors today, would be an increase from 27 per 100,000, where Texas is currently. We've scrapped and clawed to be a little better than that in Dallas, to 152 per 100,000.
Thank you, Judge Jenkins. Dr. Trivedi, do you want to add anything?
Yes, I will. Thank you. I think one of some other things to consider are that, we began to see cases in Texas, especially in the DFW area, maybe about 5 or 6 weeks ago in early March, whereas other parts of the country had also begun seeing cases a lot sooner than that, so they had begun seeing cases earlier. So whatever, few weeks of timing they've had to be able to ramp up their testing. So just trying to keep in perspective as far as
always, if anyone on the stream has any questions, anything you're curious about, feel free to ask. I'm happy to do my best to answer as long as it's not medical related.
Was that testing is available here, but a lot of it has to do with whether you have a primary care physician and you have somebody who's able to order, let's say, those tests for you. And then early on, how we had seen that there had been more stringent criteria, federally, et cetera, and that the health departments were obligated to follow as far as who qualified for testing. So we are in a complete agreement that, we need to be able to relax some of those, restrictions as far as who qualifies for testing. And really only by doing that are we going to get a better sense.
I also think it's interesting that they mentioned this, and they said they were going to talk a lot about this, but I don't know what they've actually
of people here
talked about.
With pretty mild illness, and these are individuals who otherwise would not actually be presenting for care.
I guess they've given up on their idea they were promoting last time, which is only call on a certain day based off your last name. I guess they didn't like that very much.
Could be a sign of having COVID is important as well, and that making then testing available to that. So my goal and my hope is that we would be able to increase the number of individuals being
considering
tested.
All the flights are empty, I don't know.
Thank you, Dr. Trivedi.
That's a concern.
Again, as Judge Jenkins mentioned earlier on the call, what we're also trying to do is reduce the amount of time that it takes for us to get the results back, because these extended periods before we get the results do make it harder for us to do any form of contact tracing, and that's going to be important for us in terms of figuring out what to do going forward. But thank you so much for your question, Francis.
Okay, so the next question, we have a lot of folks asking about the Paycheck Protection Program under the SBA. We have Mr. Kyle Coburn from Dallas with a question related to that. Kyle, you should be live now to ask your question.
Hi, thank you. I own a small business in Dallas, and I applied for paycheck protection through Bank of America on the second day after they released one of their restrictions on being a loan customer. I didn't receive a loan, and I don't know how I could have done anything differently to increase my chances before the money ran out. What are you doing to make sure banks hand out loans in a first-come, first-serve and not playing favorites? And is Congress truly close to extending
I think Mark
the
Cuban
amount of money
actually tweeted
available?
something about this. That was very. Let's see.
Thank you so much, Kyle. And first of all, just let me say that I'm so sorry to hear about the issues that you're having there. We have heard a number of reports, particularly Bank of America, about their practices with regards to the PPP program. Some banks have had, especially some of our local banks, have been more responsive than others, and we've seen that certain banks, Bank of America, Wells Fargo, and others have prioritized at times, from what it appears that we are seeing, are prioritizing businesses that have an existing financial relationship with them and lenders that they have already lent to. That is not the intention of the program, and I want to make that very clear. When we created the Paycheck Protection Program, the idea was to reach every small business, and whether it's a mom and pop shop or even the self-employed who maybe have never had to access credit
This
before,
is what should happen.
that they too
have it be a lottery.
will be able to get access to this program.
I mean, again, that would give
And that has
regular
not
people
been
a
the way
chance.
that it's worked out
Not
in
in
practice thus far. And this is mostly administered through the Small Business Administration and the Treasury Department. And we are working in this next bill that we will pass this week, and we will add over $300 billion to this program. So that is going to happen this week. But we are trying to make sure that particularly for those who've been unable to get access to this funding because of perhaps they have not been, they've been unbanked or have not had access to credit previously, that they are not overlooked by our banks. And so this is a problem that I'm very aware of. It's something that we are extremely concerned about.
So they're going to tell the banks, please lend to more people, but not put any enforcement
and we
mechanisms.
have encouraged and are asking the Treasury Department and the Small Business Administration to pressure our lending institutions to try and get this money out as broadly and as quickly as possible. They are going to conduct their own due diligence with all of the folks that they lend to. That is part of their responsibility. But they should not be prioritizing certain lenders over others or just skipping people and going to folks they have relationships with. That's not the intention of the program.
Or they can go with PayPal,
there will be
Stripe,
Zelle,
Cash App. Just simplify it.
Language in this bill
Simple.
that there is funding particularly
Venmo.
directed towards small businesses that have not been able to get access to the credit in the past. So I hope that you will continue to stay in touch with your bank.
Keep
You can also
applying.
reach out to
Yeah,
my
great. Your business is going to
and
burn down, but if you keep
any,
applying, then I
any
keep getting
concerns,
reelected.
try to
Yeah.
help you.
Congressional
either
model.
by putting you in touch with the SBA, or you can also, of course, try to find access to another lender if you think that would be a better prospect for you. But I am so sorry to hear.
Yeah, I write the bill, but I don't know how you get
and
money
your
for it. That's not my
application
responsibility.
has not been approved. That's the kind of story that I have been hearing a lot of, and it's extremely concerning to me. So thank you so much, and, Kyle. And if you have any further questions, we'd be happy to speak with you. You can contact my office after this.
Now we have a question regarding, a lot of folks are asking about ways they can stay safe and practice good measures to stay healthy. We have Kathleen from Richardson that has a question regarding best practices and wearing a mask. Kathleen, you should be live now and ask the Congressman your question.
Hi, thank you. Actually, my question is about wearing a mask, but I'm in the medical profession, and there's contradictory information in regards to wearing the mask and fines and even jail time that Mr. Jenkins has put out. And my concern is that the masks are not a panacea for people. They, especially all the different types of masks people are wearing and how they're wearing them. isn't really in the medical profession a great way to protect yourself or other people. So I'm very concerned that there was stated that if you didn't wear it, you could be fined and jailed. Can you clarify this?
Yeah, I can tell you.
Go ahead, Judge Jenkins.
I can tell you. So I never said that you could be fined in jail. Actually, what I said is that there would not be any fines for this, and and that we would just expect the public to honor the service of the people in grocery stores and honor the help of each other and wear their masks. Where all the fines in jail came from were people on social media. But
Gotta love
if you read the
social
order
media.
itself, first, if you look back at the press conference where it was rolled out, I answered the question rhetorically and then answered it to a reporter that there would be no fines. No one asked me about jail, but you couldn't go to jail if you're not even given a ticket. And then the next day we clarified the order so that it says in the order itself it's not subject to Section 3, and Section 3 is fines and any sort of jail from that. So that is just kind of a rumor that was started by people that are opposed to the order. You're in the medical profession, so the idea of this is similar to when you're transporting a patient within the hospital and that patient is infectious and they put a surgical mask, and every hospital does this, they put a surgical mask on that infectious person as they move them from place to place, because they know if that infectious person coughs or sneezes or whatever, then a lot of that can be caught in that face covering. So it's the same concept as we go to the grocery stores. What the CDC has been saying on this, they had changed their position in early April, but what they have said is the idea of the mask is not so much that it protects you, your mask protects you.
See, I think this is still a great
your
opportunity
mask protects
for the
people
congressman
else.
to demonstrate
So
leadership
that,
and say, I recognize that
if
many
every one of
Americans
the
don't have
grocery
access to
stores,
masks.
or
They don't have
90%
access to
of
PPE,
good
so
people
I'm
in
going to
grocery
lead the charge
are
to
wearing their
onshore
masks.
U.S. American
And
manufacturing, bring things
if
back,
they sneeze, if they,
and actually get people
cough,
protected. So you're not just
a lot
like
of that
using your
we're wearing
shirt
their
or
mask.
using some random piece of
It's just
cloth
their
and like,
mask.
well,
They're
that's all I got,
cloth.
so better than nothing.
They're not really wearing
But
surgical
again,
masks, but
with 3 questions
they're
in,
cloth-
we have
cloth
behind
cover.
testing. I don't know. We don't have stuff, but we don't know we're going to get it.
Where this came from
PPP
is
status.
that as
Congress going to
doctors,
pass money. Good luck if
the
you get
public
it.
health authorities,
And how to stay safe?
hospital
Well,
workers, how
just
can we
wear
speed this up
some face
faster
coverings and
so that we
don't
get
listen to
back to
social
life
media.
normal?
This is
Or
not
we
leadership.
can
This is
over.
just dumb.
And one of the things they said is, well, if you'll follow the CDC guideline that everyone wear a mask to the grocery store and the big box store, and when they're riding on the DART train, Uber taxis, Uber cars or taxis, this will speed things up.
Uber taxi.
So that's where
that's the
came
quote of the night. Uber
and,
taxi.
unfortunately, there's a lot of misinformation out there, but it's a CDC guideline recommended by President Trump, okay, recommended by the local doctors here, and nobody's going to jail if they forget their mask.
Thank you so much, Judge Jenkins, and thank you, Kathleen, for your question.
Okay, so we have a lot of folks asking questions
Changes.
regarding
I'm gonna make this
Social
questions
Security and
with
whether
no real answer.
and how folks on Social Security will
that
receive their stimulus checks.
0 for 3.
I have a question
Stimulus checks.
from Larry in Dallas regarding Social Security and stimulus.
It's
Larry,
funny they
you
mention
be
that.
live to ask your question now.
Let's see if we can find
Yes,
another
thank you very
image
much.
here.
My question is, I have understood and heard from several people who have been working and have received their stimulus check, but I don't know of anyone yet I've spoken with. That's
China's
on
also
Social
receiving your stimulus
that
checks
has
too,
received
so
their
hope you don't
stimulus
mind
check yet.
people overseas
And I have
getting money
checked
before
the
you. But
website
it's
for,
happening.
the IRS website online and attempted to check my status, and I get no record of any information that IRS has with regard to my status. So I'm kind of in the dark and puzzled and wondering if any other people are having the same problem.
Yeah. Well, thank you so much, Larry. We have certainly heard from plenty of folks who are wondering about the status of their checks. And after this call, if you want to contact my office, we can also contact the IRS and see if we can get you a direct answer on your particular case. But just to clarify, for Social Security recipients, they are eligible for the checks as long as they don't go above the $75,000 individual threshold, or $150,000 threshold for a household. And your Social Security
so all we're being told is your own money,
that
but
threshold.
no one knows when it's coming.
You receive your payment in the same way that you receive your Social Security benefits, whether that's through a direct bank deposit or loaded onto a direct express card or mailed to your home address. And just so everybody knows the time frame here, the week of April 13th was when the Treasury Department first started doing direct deposits to Americans who they had access to their banking information. We were told, and what it appears to be true, is that they said they're going to start mailing checks a couple of weeks after that. So it looks like that'll probably be next week that the checks will start to be mailed out to physical addresses. And they will go out from the bottom going up. So in terms of, so for those who have the lowest threshold or the lowest amount of earned income, they will be the ones who have checks mailed out first, working the way up. And so for our veterans, for our Social Security recipients, you will receive your check the same way you receive your benefits, whatever method that is, whether it's direct deposit or through a check in the mail. So it may be that if you receive a physical check from Social Security that you are not yet in the queue for getting your check in the mail, but it will be coming. But again, if you want to,
it'll come. I mean, you may be evicted or not having to eat, but your money will be there eventually.
Find out where you stand, and I appreciate that a lot of folks have a ton of frustration around this, and I understand that.
Do you appreciate that, though?
Trying to work with the Treasury Department to make sure that everybody who has questions, that we can try to get their questions answered as quickly as possible. So thank you so much for your question, Larry, and hopefully if you need any more help,
I just think it's very concerning that he didn't bring up legislation from his fellow Democrats who actually have a really good solution to get people money quicker.
Next, we have a few folks both online asking about the status of the United States Postal Service during the crisis. I have Lois Swartz from Wiley with her question regarding the Postal Service. Lois, you're live now to ask a question.
Yes, I read an article in the paper recently. Incidentally, Representative Allred, you are doing a fantastic job. You have wonderful answers to every question. You have more information that I trust than a lot of stuff that's on the newspapers and all that. And I have voted for you. So I appreciate you reaching out like this and clarifying. And now we're going to talk about the post office, if you don't mind. Oh, and let me thank you also for opening the Garland Hospital for the veterans.
This feels like a radio segment. Long-time listener, first-time caller.
Oh, thank you, Lois. Go ahead.
I love those people. They're the greatest. Whether it's on TV show, radio show, yeah. Always make me laugh.
Tiny town when you moved here. It is not a small town anymore. It is a medium-sized city with like 52 or 62,000 and growing like crazy. What do you mean you're going to close the post offices?
Yeah. Well, thank you so much, Lois, for your question. I could not agree with you more about how important the Postal Service is. And you mentioned the Veterans Hospital in Garland that we were able to get. Well, I'm on the Veterans Affairs Committee as well, and the Postal Service employs 92,000 veterans. It is one of the agencies in our government that has the highest percentage of veterans who work in the Postal Service. So these are not only public servants who are serving the public right now in their role of delivering the mail to us, but they are also folks who have served our country. And I just cannot think of any agency that's more important for us right now for staying in touch or for getting deliveries of critical items than the Postal Service. Now, what's happening here is that just as every other area of our economy has been hit during this crisis, the revenue for the Postal Service has also taken a large hit. And so they are running out of money and they need to have support to keep going. And I've joined a letter with a number of my colleagues trying to make sure that in our next bill we include money for the Postal Service. And we have tried in the past couple of bills to get this done, but it has been rejected by the Senate and by Mitch McConnell. And so I don't really understand the rationale behind trying to get rid of the Postal Service. I don't know what interest that serves. I don't really know how that could be a good thing at all for our country, or how you could say you support our veterans if you want to let the Postal Service go bankrupt. But I promise you that I will do everything I can in my individual capacity as your member of Congress to try and make sure that the Postal Service is strong and continues to deliver the mail and to do everything that it's done throughout our history. And it is really one of the most successful things we've done in our government. In fact, the Postal Service moves almost half of the mail that moves in the world. The U.S. Postal Service moves it. And so it employs a lot of veterans, it employs a lot of people. It does an important service, and it does it for a low cost. I can't imagine anything that's more, should be more common sense supporting that. So thank you so much, Lois, for your question, and I promise you we'll do everything we can.
Is out the post office. I was going to see if I can find it.
Okay, so we have actually another, I believe it's Lois Hunter from Garland, is asking a question on stimulus and state and local governments. We had a lot of questions with folks asking about cities and states and public hospitals. So now we're going to go to Lois. I believe you're live now if you want to ask your question.
Yes, thank you for taking my question. First of all, I want to thank you, Congressman Alright, for helping me and my husband out with a problem with Social Security a month ago. I appreciate that, and thank you very much. My question is, they had mentioned when they were talking about this before the first stimulus was released, that the $1,200 was going to be the first installment, or it wasn't enough for the people who make $75,000 and under, and they had mentioned that there might be another one. So my question to you, Congressman, is there going to be another stimulus for the low income or workers, as they called it on the television? I think they say workers, for more stimulus. And my second question was about, would the state and local governments receive the funds that was in that in one of the packages that's coming out? And the reason why I asked you that is because D Magazine had printed in there for the city of Dallas, they state they may be getting funds. They don't know if they're going to get the funds.
We don't know. We have no idea what's happening.
Would they get the state and local and city government?
Maybe it'll work out. Maybe it
They
won't.
have also said that they would assist with rent and mortgage.
Yes. Yeah. Well, thank you so much, Lois, and I'm glad we were able to help with the Social Security issue. So with regards to the stimulus checks, right now, the checks that are going out are the only checks that we have passed into law. But we passed what was called the CARES Act. That's what those checks were in the CARES Act. We are now discussing the CARES Act 2.0, and we have been in the House discussing doing another round of payments. Now, I can't promise you that that is going to end up in the final legislation, because it'll be subject to negotiation with the Senate and the White House for it to become law. But many of us recognize that the $1,200 checks, the first installment of that, likely will not be enough to get folks through this crisis, and that we may need to have another installment or even continuing installments over time, just to make sure that we get through this crisis. And so we are certainly discussing it, and I can tell you that it's something that I think we certainly should consider doing, particularly given that we know this crisis is going to last for a long time. Even if we are able to start opening up parts of our economy, that we will be under some orders that will impact the economy for a while, and we'll likely have to also deal with a global recession.
About working families.
In regards to the state and local help, it's a good question, because right now about 70% of cities around the country are anticipating that they're going to have to cut some form of public service. So as you probably know, all of our cities and our municipalities have set budgets. If they go above that budget, then they have to cut services because they cannot borrow, they cannot go into debt. And
this
so
is
what
the
we've
problem.
tried
They
to
have
do
to
is
pay
provide
their pension
enough money in
obligations.
the first CARES Act to try and get money to the state
75 years.
so
Who's
they
paying
could
pension
portion that
obligations
money
75
to
years
the
in
cities
advance?
to try and make sure they get through this crisis. We have not seen that go as efficiently as we would like in the first round, and we were trying to get money for the states and municipalities, for the cities and municipalities, in the bill that we're going to be considering this week. But it was something that the Senate rejected and would not accept in this bill. And it was the president, I think, also said in either a press conference or in an answer to a question, said that he thinks that will be in the next bill coming afterwards, so which would be the CARES Act 2.0. So I'm still hopeful that we will get that out because, and I want to say why.
But we don't know.
Because for our cities and our municipalities, when they have to cut essential services, they have to cut the things that people really rely on, whether it's trash pickups or just furloughing employees. And these are folks who we need to be on the job right now. And so we don't want to force our cities and our municipalities to make these tough decisions from a crisis that they had nothing to do with and that they are responding in many cases heroically to. And so we want to support them and make sure they have the money they need. And that's going to be a focus for me, particularly for Garland, Richardson, Saxe Wiley, the cities in my district that are under 500,000, which we had a threshold that is probably more complicated than we want to get into. But those are the ones that we're very concerned about that they may not have gotten funding from the first round. We want to make sure they get it in our second round. So thank you for both of your questions, and we'll certainly be working on that, and we'll try and keep you updated on it as we go through this.
Okay, we have time for one more quick question. It will be our last question for the evening, and then we'll have to wrap up. We got a few questions on more or less the state of our democracy in the upcoming elections, both the primary runoff and making sure those safe, as well as the general election in November. I have Tara Mockley from Dallas who has a question regarding making sure we keep voting safe. Tara, you should be live.
I am. Thank you, and thank you again for providing us this forum to communicate with you. Given the chaos that ensued in Wisconsin when they tried to have their primary during this pandemic, I wanted to get a better understanding of what Congress is going to do to make sure that everybody is going to have a way to vote safely in not only the November election, but other elections that are upcoming, including the availability for people nationwide to vote by mail.
Absolutely. Well, thank you so much, Tara. This is something that's near and dear to my heart, and I care very deeply about it. And I do believe, based on, as you said, that what happened in Wisconsin was a disgrace. Having folks standing there in long lines with masks on and afraid for their own health, just to interact with their democracy when we can have safe and verifiable elections done by voting by mail, and we already do that, of course, in Texas for folks who are 65 or older, or if you are out of town for the entire election period, you can vote by mail already in Texas. Now, you might have seen that recently a state judge declared that while we are under this crisis, this pandemic crisis, that fear of coronavirus exposure is a reason to be able to vote by mail, and so you would be able to vote under this ruling in the upcoming runoffs by mail. Now, the state's attorney general has said that they're going to challenge that ruling, and there is some potential that ruling will be overturned. And in the CARES Act 2.0 that we've been discussing, we passed one bill, that was a $2.2 trillion package that we passed, that was CARES Act 1. In the 2.0 bill that we're discussing, I have stressed that I believe that we should provide funding and to require states to offer vote by mail in the November elections, should we still be under the threat of this pandemic.
I just don't know why you can't have vote by mail always.
Political in any way, shape, or form. This is only about making sure that we have a fair election in which people are able to interact with their democracy without being afraid for their own health. As our healthcare professionals have been stressing for weeks and months now, we want to limit gatherings of large groups of people in small places and touching the same equipment, the same door handles, interacting with the same things. That is all that a polling place is. And in Wisconsin, one of the issues they ran into, why they had to reduce their polling places so dramatically, wasn't that they had to reduce them because they didn't have enough folks who were willing to work as election workers in those polling places. Any of us who have voted in Dallas County or in Collin County know that the folks who are working in the election, who are administering the election in our polling places, are usually also the folks who would be most at risk from exposure to COVID-19. And we want to make sure that they don't have to fear for their lives for helping us conduct our election. So yes, we need to make sure that we combat any incidents of fraud and make sure that it is that there are ways through signature matching and other techniques to make sure that we limit the ability for anyone to conduct any kind of fraudulent voting. But voter fraud is still exceedingly rare in our country, and for the most part in Texas it is exceedingly rare. And we need to stress that and understand that we have a duty to make sure that we have a free and fair election this fall, so that the governments that emerge from it, whether it's state, local, or federal, are legitimate governments that have been elected by the will of the people. And that's something that I'm very focused on and believe very strongly that regardless of the outcome of the election or who it may benefit or not, that it's the right thing to do to make sure that as many people as possible who are eligible can cast a ballot without being afraid for their health. So with that, I just want to say thank you all for joining this call. Again, this is Congressman Colin Allred. This is our third telephone town hall that we've held in the last few weeks, and we will be continuing to try to stay in touch with you through every means possible to get information to you both about what we are doing in Congress and also to pass on the information from our counties and from our state leaders as we head into these closing weeks of April. And as Judge Jenkins mentioned earlier, all of the projections that we've seen have shown that we will likely see our highest spike of this particular curve in late April and early May. And so we will still see increases probably in positive tests. We may also see, unfortunately, that we will lose more of our neighbors and our friends. And every single loss of life is something that we all feel very deeply. And we also recognize the economic impact that our mitigation strategies are having.
Well, it sounds like we're about wrapped up. I guess we'll kind of be wrapping up here.
But I want to be very clear.
Check one more time.
The economic outlook for our country, for our state, and for our area is also tied to the public health outlook. We will not get over the economic aspect of this until we beat this virus and until we are able to, as Dr. Trivedi said, reduce the transmission of this to the point that
do you have any questions you want to ask?
To interact with their economy and get back to normal life. And that may be some time. And I want to be honest with you about what we are facing and how long this fight may be. The experts that we have been briefed by have said that we are combating this curve, but we are also looking at something that may be more of a roller coaster than a single curve, where we have spikes and we have valleys. And it may be in some areas that there are become hotspots and other areas are not. And we will have to be aware of that, and we'll have to be prepared to take whatever steps are necessary to make sure that we save as many lives as possible. And so I have been just incredibly impressed and just am so humbled and just thrilled that North Texans have come together so well during this period to help each other out.
Sounds like we're wrapping up. I guess I'll wrap up as well. Thank you as always so much for joining us here on Inception Town Hall. Remember to smile, stay safe, take care of one another, and we'll see you next time. Good night.
People who have pulled together to so